Karen Anderson Oliver. As an expert in implementation science, I've helped many healthcare organizations over the past 30 years implement, improve, and sustain services for mental health and substance use disorders. One reason I'm glad to be working on ESPERT implementation and improvement is that most patients who would benefit from alcohol and drug treatment never receive it. ESPERT can help some people get the treatment they need, and it can help many other people make changes so they live happier and healthier lives and avoid the need for treatment in the future.
Hi, I'm Rich Brown. As a family doctor, a consultant, and a former professor at the University of Wisconsin School of Medicine and Public Health, I've worked with dozens of primary care clinics, including FQHCs, to implement ESPERT. The clinics I worked with in Wisconsin demonstrated high patient satisfaction with ESPERT, significant declines in drinking and drug use, and substantial reductions in healthcare costs. Karen and I are both so happy to be working with Texas FQHCs to help you maximize the reach, effectiveness, and sustainability of your new or existing ESPERT programs.
We're especially glad for the opportunity to help you with ESPERT at this very difficult time. As you know, the COVID-19 pandemic and the related recession have been especially hard on patients and families who are typically served by FQHCs. This makes it even more important for FQHCs to identify and intervene for patients with unhealthy drinking and drug use, and ESPERT can be extended to address anxiety, depression, and sleep as well. We'd like to take the next few minutes to introduce you to the key learning materials for our ESPERT Institute and ask you to get some important work done in advance of your first learning session on January 28th. We know you're busy, so we've boiled down that work to 5 resources: a workbook, a checklist, and 3 readings.
First is our ESPERT workbook, which we developed specifically for this ESPERT Institute. EPIS stands for Exploration, Preparation, Implementation, and Sustainment, the 4 key phases of work that implementation scientists recommend for taking a clinical program from start to durable success. Please get as far as you can in the workbook, which will guide you in thinking about how you might utilize best practices or adapt them for your clinical setting. Feel free to fill in the blanks right in your workbook or create a separate document with your responses, whatever you find easier.
Next is the ESPERT EPIS Checklist, which is meant to be a companion document to the workbook where you can keep track of which sections of the workbook you've completed and whether additional work is required, and if so, who would be responsible and on what timeline.
The first of the 3 articles we hope you'll have time to read is one that I wrote on best practices for behavioral screening and intervention, or BSI. BSI is an extension of ESPERT that addresses a variety of behavioral risks and disorders beyond unhealthy drinking and drug use. The best practices come out of the SAMHSA-funded project I mentioned earlier, where my team and I worked with 33 primary care clinics in Wisconsin and documented high patient satisfaction, substantial declines in drinking and drug use, and substantial healthcare savings. In this project, we and our participating clinics learned together what would work best in most settings, and this article covers those lessons learned. If you have questions about any of the best practices recommended in the workbook, you'll probably find answers in this article. Or, of course, feel free to contact us at any time with questions.
The second article contains a very timely set of recommendations on how to deliver telehealth services to patients with a high prevalence of previous trauma. The article comes out of a telehealth program that serves veterans with a high prevalence of PTSD from battlefield experiences. Many of the lessons learned from this program are relevant for patients with alcohol and drug use disorders because many patients with those disorders, especially women, have suffered and continue to suffer from trauma in their lives. Rich and I believe that an important way to enhance patient engagement and retention in your ESPERT program is to deliver ESPERT via telehealth. This article gives many valuable pointers about doing so with a trauma-informed approach.
The third reading comes from a SAMHSA-funded project that brought experts together from across the country, myself included, to create a very practical guide on implementing SBIRT. It covers clinical and organizational changes that can make SBIRT programs effective and successful. Some of the recommendations differ a bit from those put forward by other resources, and that's good because there's more than one right way to do SBIRT. We want you to make decisions about your SBIRT program that you believe will work best given your patients, providers, staff, resources, and constraints.
That's all we wanted to cover, other than to say thank you. We know you're already doing so much to help patients who have so many complicated needs and few other places to access care. We're so glad you're participating in our SBIRT Implementation Institute, and we look forward to working with you. Please email us at any time if there's anything we can do to make this institute more useful for you.